When my husband saw exactly what they had to do to me to have an episiotomy, he was completely fine with waiting as long as it took for me to be ready to have intercourse again. It was a little bit traumatic for him and me. Hey everybody, I am Dr. Nicole, but I am also a mom of two, and so today I am going to be hanging up my doctor uniform and talking to you as from my experience as a mom myself. I actually had an episiotomy with my first birth. So at this time now today, as of filming, it's been about 3 years since the birth of my son. During his birth, I ended up with an episiotomy. To start from not the very beginning, but a little bit of the beginning of his story, he did not want to come out. He was so happy and comfortable inside my stomach. And so finally at 10 days past my due date, after trying stripping my membranes and me doing all the crazy things they say about induction at home, except for one trick that I think actually works that I didn't know about then. I'll link that above if you are someone that's like, oh, I really want to have my baby, I want to have it soon, and you're past your due date, you might want to check that video out. Either way, he did not want to come out. I did not know that trick, so we went to the hospital to be induced, and I was just devastated because I really wanted this non-medicated vaginal birth, and I was so afraid if I had to be induced with Pitocin that just wasn't going to happen. Thankfully, he was very cooperative at the very last minute, and when we got to the hospital, before they even did anything to induce me, he actually started making his way out, and I started to have contractions, so I was so thankful for that. Fast forward about 11 and a half hours after that first contraction, and things were going really well. My nurse had said, yeah, you're fully dilated, and so we are just gonna wait until your body is ready to start pushing, and then you just let us know, we'll do this thing. And I was like, okay, that's kind of weird that she would say till my body starts pushing, but she was exactly right. So now with all my training as a pelvic floor physical therapist and getting special certification and working with moms and the obstetric population, I now know all about the fetal ejection, I'm not even saying that right, fetal ejection reflex, which is basically when your body starts to spontaneously push your baby out. You may not know, but actually women who have had a spinal cord injury could deliver their baby vaginally because their body will just start pushing their baby out. It's a really amazing thing that our body can do. And depending on if you've had an epidural or not, or if you start pushing before that takes over, you may or may not have experienced that. But for my first son, I definitely experienced that. And the nurse was like, okay, well, we're gonna get the whole team in here, and but you can start to push with that urge. And I was like, okay, sweet, we are getting so close. In my mind, I'm still like being a little bit guarded because I'd heard all these stories, especially one of my good friends who had had her baby about a year before me, and she had pushed for like 3 hours, just a very, very long time of pushing. So I'm like, okay, I'm pushing, but still need to be prepared because this could take a while. I'm pushing with contractions and doing all the things that I had prepared to do. And about 25 minutes into pushing, the doctor said, you know, like, they put oxygen on me and they're like, baby's heart rate is dropping a little bit during contractions, and we really think the best thing to do right now would be to give you an episiotomy. That was definitely not part of my birth plan, but it was a better option compared to C-section for me in my mind. So I was like, okay, well, if this is best for baby, I want my baby to be safe, so let's go ahead and do that. She did. And you may be thinking, if you've never experienced an episiotomy, like, oh, that must have been so painful. And to be completely honest, it really wasn't painful at all. There's so much going on down there, the ring of fire, if you've ever heard of that, where everything is being stretched so much that there's kind of like this burning sensation. There's just a lot of pain down there because a head is trying to come through your lady parts. And so there's a lot of discomfort going on down there. So to be completely honest, I felt it, but it wasn't like, oh, that felt really painful. This is so crazy though. My husband said she grabbed a pair of scissors to cut. I guess we should start with what exactly an episiotomy is. There's a few different places that they can cut, but basically they are making more room for baby to come out. Your opening is so big, and basically they are thinking it's not stretching far enough, fast enough, and so they're making a cut to give it a little more room to open up. Hold that thought. I want to show you exactly what I mean. Okay, I have my vaginal opening. So if this was your vaginal opening, Basically, this is how much room there is for baby's head to come out, and obviously it's stretching as much as possible. But what they do with an episiotomy is often they will cut to make that opening a little bit bigger. Now, if they cut down here, that's one type of an episiotomy. They can cut the side, they can cut in different places, but typically they cut down here, which is the space in your perineum between the opening to your vagina and your anus, and so they will cut that a little bit. Now, there is debate about well, there's not much debate anymore. They used to do a lot of episiotomies to prevent tearing because they actually thought it was better for you to, for them to control where the cut was than to just let things naturally tear. There's a lot of research that's been done since then, and I made a whole nother video about that. I'll put that above if you're interested. That basically shows actually your recovery is going to be harder, and more likely the incision is going to be bigger, or the cut through your perineum is going to be more severe with an episiotomy. That's why they don't routinely do them anymore, but they used to. Like in my mom's generation, that's what they did. So anyways, they make that opening a little bit bigger, so now hopefully there is more room. You can see that, more room for baby to come out. With me, the doctor got the scissors, went to make that cut, and threw the scissors to the side, my husband says, and got a second pair of scissors to try to cut that. So I have no idea if that made my incision gnarly. Obviously they didn't elaborate on that, but it did not, I don't think it helped my recovery at all. So I'm not sure why they had dull scissors there or what the deal was. Regardless of that, I had an episiotomy. After that, very, very quickly, I think it was the next push maybe to, my son's head came out. The cord was holding him back a little bit, but they popped that over his head and he just flew out literally at that point, which was a very, very exciting moment for all of us. It was awesome. Like, then they put him on my chest and it was just like, oh, that's just the most amazing thing ever. That was all fine and dandy. I had never been through a postpartum experience before. I had no idea what to expect. But I did know that immediately after that, when I got up to go to the bathroom, because they had pumped me full of IV fluids. Wait, back up. Before that, they sew you up, which I just felt like was the most painful thing of this whole experience, which is crazy because I've just had a lot of contractions and delivered a baby, but for some reason the sewing up was just awful for me. There's a hormone in your body that makes you shake, and it made me feel so cold, and I was like shaking, and I was like, I need more blankets, and they're like, oh, you know, it's just hormones, whatever, but they're trying to sew me up, and they give you this shot to numb you, which didn't feel all that good, and just, I felt like it was not a fun part of the experience. I'm trying to enjoy the skin to skin, but that was definitely a distracting moment for me. They get me all sewed up, and then I remember being like, I have to go to the bathroom so bad. And I'm a physical therapist, and I know the rule at the hospital is that you're supposed to be with someone, because the nurse had said, when you have to go to the bathroom, call us. So we called, but I just didn't feel like she was coming quick enough. My husband was like, okay, we're gonna start walking to the bathroom, I guess. And the nurse comes in and she's like, oh, I need to be with you, whatever. We make it there, and I go to the bathroom, and immediately, like, that is an uncomfortable thing. Even just peeing does not feel very good after a baby has come through that hole. Especially after episiotomy, I felt like now that I've had my second birth, it really felt bad. When I went to go sit back on the bed, every time I would get up and down, it just felt awful. It felt like I couldn't sit on anything hard. Well, it didn't feel like it. I couldn't sit on anything hard without a lot of pain. To get up, I had to like slowly lift myself because it just felt like any changes in sensation down there were just awful. Fast forward, I'm like getting by, you know, at home. About a week after my recovery, like mentally, I'm ready to get out. I want to do something. So I go to the grocery store. I go for maybe 2 items. And when I got home that night and the next day, I was so sore in my pelvic floor. The best way I can explain it was like an ache. It would be like if you worked out really hard, not just to the point of like, oh, I feel like I did something, but maybe a little bit too hard, and you have that like kind of achy sore feeling. That's what my pelvic floor felt like. It was something I never experienced before until childbirth. Fast forward a little bit more, I go to my 6-week follow-up, and they look at everything. They're like, yes, the incision looks healed. You can start exercising and having sex again. And at this point, I'm starting to do my training as a physical therapist, and I'm like, yeah, I don't think so. Like, I don't think that things are gonna go well down there. What about diastasis recti and whatever? I'm asking all these questions, and thankfully I had a provider who was like, you know, I actually think these are things better addressed with a physical therapist, a pelvic floor physical therapist specifically. And I'm like, Yeah, that's definitely true. One of my classmates was ahead of me. She had decided right out of the gates that she was going to specialize in women's health. And so I was like, I called the clinic where she worked at, and I was like, she would be, you know, just amazing. I want to work with her. And there was like a 2-month waiting list to get on her schedule. So I'm like, oh man, but luckily they called me a little bit early and said, okay, there's an opening, you can come on in. So I think this was October. So my son was born end of July. In October, I got in for my first therapy appointment. So I think it was between the 8 to 12 week mark, somewhere in there. I decided to go see a physical therapist. I had tried having intercourse and we just attempted penetration, and it was like, closed for business, not going in there, no way, no how. Like I said, my husband was super understanding. He saw what my body went through, and we had never been through a postpartum experience before. So we're like, you know, maybe this is normal. I'm asking friends, like, how long did you feel like you had to wait? And my one friend who'd had a baby just a year earlier was like, you know, it was definitely uncomfortable those first few times. And I'm like, okay, well, this is like not even possible. Like, not just uncomfortable, but like there is no way without excruciating pain for me. Started working with my I always want to say Pelvic, I don't know why, with my pelvic floor physical therapist, and she was so great. I actually took a lot of my experience and I have put that into practice along with all my training into what I do with patients now, because I just felt like it helped me so much. Some of the things that are focused on during those sessions are they actually do trigger point releases. You may or may not realize this, but your pelvic floor is made up of a bunch of muscles, and they form a hammock at the bottom of your body, basically holding everything up and in. Obviously, during birth and especially during episiotomy, when things are cut, there's a lot of trauma that happens down there. And so those muscles can get trigger points. Just like if you know, are massaging your neck, you're like, oh, that spot, or you've ever been to a massage and they're like, oh, you have some like trigger points here. Basically, it's a point that is radiating pain to a lot of other places. And so with very gentle technique called strain counter strain, she helped me get rid of those trigger points and helped things totally relax down there. It took several sessions. I was seeing her like every other week, I believe, every 2 to 3 weeks. I would have homework, different breathing things to do at home, different stretches to do at home, focusing on deep squats and opening up my pelvic floor. And then a couple sessions in, she talked about maybe you should start using a dilator. I think this is what YouTube gets really mad at me for, because they think that these are toys, but they're not. These are actually medical tools. This is actually the exact dilator that I used after my birth. Basically what a dilator is, this one is pretty hard. It's like a plastic. This was free from them, so that's what I used. Since then, I have found some other options I'm going to show you in just a minute. But basically what this is meant to do, you start with something small and you are basically trying to tolerate penetration with this tool. You're just barely putting it in. Now, some of the main things you want to do is definitely use a good lubricant. You may or may not know, but after you have a baby, you tend to be really dry down there. And so you want to keep things nice and lubricated, or else they're really painful. So you lubricate this and you're basically just tolerating it being inserted. Then you're working on tolerating it going in and out, and you can even do trigger point releases with a dilator. Now, Intimate Rose has come out with this really cool tool, which I didn't know about at the time, but now I recommend it for my patients, that can basically treat trigger points on yourself. So I could have been doing what my therapist was doing for me at therapy at home on my own between sessions. And this is what I actually have a client doing right now. She bought one of these tools, and whenever she increases her activity, she knows that her pelvic floor is going to have an increase in trigger points and pain, and so she gets out her little tool. She just puts pressure on the trigger point, and you move your leg around till you don't feel pain there anymore, and then it's released after 2 minutes of holding that position, and it feels a lot better. So dilators are really cool. There are different brands. These are some brands that I actually partner with because I think that their stuff is so great. This is part of Soul Source. These ones are more flexible. They're silicone, and again, these get confused for toys. They're not toys. I suppose they could be used that way. But these are medical tools used to gradually start increasing the size of what you're able to tolerate during penetration. Intimate Rose is another company that makes really, really great and also very beautiful dilators. But basically, you start with a really small size and you gradually start working up to a size that you can tolerate. I have some discount codes for Soul Source and Intimate Rose. Use them if you like. Don't feel any pressure to use them, but who doesn't like a good deal? So I'll put those in the description below if this is a situation that you're in and you're like, oh, I've been looking for something like this. That was part of my journey. And then gradually starting to exercise again with using the trigger point releases to make sure I could tolerate those increases in activity. In this time, I still wasn't able to tolerate intercourse, so I still wanted to connect with my husband, and so we still did things, foreplay and other things besides penetrative sex. There's lots of other options out there. So we did those things, and usually each time we would like attempt penetration. And every single time it didn't go beyond foreplay because I was like, nope, that doesn't feel good, and we would stop. But each time it would get a little bit more, until finally, after working with the dilators and my therapist, we were able to tolerate penetration. And then from there, you know, progress to thrusting and all the things that come after that. But this was a 9-month journey before I was able to tolerate intercourse and not experience pain anymore. A lot of people feel pressure that they go to their 6-week appointment and they feel like, I should be having sex again. That's what all my friends are doing. That's like, this is what should be happening. Don't feel like that at all. Like, there are many of us, myself included, that it takes 9+ months to be able to feel comfortable, let alone pleasurable with sex again. So take as much time as you need. That being said, just waiting for things to get better probably isn't the best solution. There's a lot of scar tissue in there that needs to be worked out. That was something else that I did in therapy. There's trigger points, like I said, and you need to get that opening and your vagina used to sensations again, and associating those things with good. You really can't just hope it's going to go away on its own. You need to work with someone like a pelvic floor physical therapist to come up with a plan to make things feel better, and not just like cross your fingers and hope for the best, because most likely that's just not going to happen on its own. In the meantime, I had started to increase exercising. At 6 weeks, I was starting to do things for my core, but it was very gentle. It was not like jumping around and a lot of cardio. I wasn't running. I was very much just focusing on exercise where I am building core strength, not with crunches or planks. I have a video, I'll link that above, about why I don't think that's a good place to start after you have your baby. That's not where I started either, but gradually I started to tolerate more and more exercise. And thankfully, just about the time I got pregnant with my second son, which was about 13-14 months postpartum, I really was feeling back to normal. But it really did take that whole amount of time focusing on self-care, working with professionals, and kind of getting myself going again. Something else worth mentioning is that I did experience some incontinence postpartum. This is not something I'd never experienced before, because I have definitely experienced leaking with like laughing or sneezing before kids, but it was definitely something that came back and I noticed again after having my son, and so that's something else I had to work on, was getting my pelvic floor strong again. So there was lots of different things to work on with my pelvic floor after my episiotomy, and it was a long journey. I think I shared most of the important parts of my story, but if there's something I left out, I am pretty much an open book. You can ask me anything. I work with vaginas for a living, so really nothing is off limits. Feel free to comment below what other questions that you have. I am more than happy to answer them. I'm also going to put my email, my website, how to connect with me down in the description below, so if you don't want the whole world to see your question, feel free to connect with me that way, and we can I can point you in the right direction there. If you love all things birth, periods, postpartum, pregnancy, and everything in between, this is definitely somewhere that I hope you will call home. I would love to have you subscribe to this channel, because that is what we pretty much talk about all the time here. On that note, I'm gonna go ahead and throw my son's birth story up over here because it gives me warm fuzzies, and it might just give you some warm fuzzies too. Until the next video, have a fantastic week. I look forward to seeing you all there.